Welcome back. This is part 3 of the ECG Axis tutorial. I'm Adam Thompson, your host and educator for this series. In part 2, we talked about this here. We talked about the hexaxial reference system, how we get the hexaxial reference system, and sort of the mean axis and what we're actually looking at and looking for. And in this part, we're going to actually use it and discover our EKG QRS axis from a 12-lead EKG. So we only need for now these first 6 leads. We're not doing the precordial axis just yet. We're doing the frontal plane axis, and we get that from our 6 limb leads. And what you're going to do is this 5-step process. You're going to determine the equiphasic lead. You're going to find that lead on the hexaxial reference system. You're going to find out which lead is perpendicular to that lead, and then determine if that perpendicular lead is positive or negative, and then you're going to find your QRS axis. Now, I want you to think about what we're doing here. Why are we finding the perpendicular lead to the one that's equiphasic? Well, what does it mean for a lead to have an equiphasic QRS complex? We said that before, didn't we? We said that if this is the lead that we're looking at, okay, and the QRS axis is going perpendicular to it, we get an equiphasic QRS complex. So if we know which lead is equiphasic, then we know that the direction of our mean QRS axis here is going exactly perpendicular to that. So whatever lead is perpendicular to this lead, let's say this is lead 1, whatever lead is perpendicular to lead 1 would have our QRS axis. Let's take a look at an example, and I'll explain. So step 1, find the equiphasic lead. Where is it? Well, in this example, it's not lead 1. Lead 1 is almost all positive. Lead 2 is all positive. Lead 3 is all positive. AVR is all negative. AVL, look at AVL. That's kind of biphasic. It's almost equally positive and negative. So that one's about equiphasic, right? AVL. So find AVL over here on the diagram. We have AVL here. So AVL is right about there, okay? And then which lead is perpendicular? Remember, we said perpendicular is kind of like that, right? It's at 90-degree angle. Which lead is perpendicular to AVL? Well, if AVL is here, that would be lead 2. Lead 2 is certainly perpendicular to AVL. So now we have to look back at our 6 leads for lead 2, because we know that right now our QRS axis is either at 60 degrees or it's at negative 120 degrees. Because lead 2 has 2 sides. So looking at lead 2 on the 12 lead, we see that it's positive. So it's got to be going this way, right? It's got to be going towards the positive electrode. So 60 degrees, or just about, is our QRS axis. And it's going to be about 15 degrees, give or take, of that 60-degree mark. And that's where we get it from. Okay? So that was kind of easy. It wasn't hard. Looking here, we said it was at 60 degrees, so we could say we have a normal QRS axis. It's normal, there's no pathology, or at least there's no pathology causing axis deviation. So again, it's 5 easy steps. Determine the equiphasic lead, find that lead on the diagram, you're going to find whatever lead's perpendicular to the equiphasic lead, and determine if the perpendicular lead is positive or negative, and then find your axis. Let's look at another one. All right, looking at this 12 lead, okay, which lead is equiphasic or the most equiphasic? And another hint, if it's the smallest QRS complex, is definitely the lead that is most equiphasic if you can't find one that's really equiphasic. So looking at this, I'd say that AVR is the only one that is biphasic, really, that really has, it's almost equal, right? It's a little bit more negative than positive, but it's almost equal. Okay, so we'll use AVR. Looking over here at AVR, which lead is perpendicular to AVR? Well, that would probably be lead 3, right? And another hint, all your augmented leads are perpendicular to your numbered leads. So lead 1 is perpendicular to AVF. Lead 2 is perpendicular to, we said AVL before. And lead 3 is perpendicular to AVR. So we said lead 3 is our perpendicular lead. Is it positive or negative? Is it positive or negative? Oh, it's certainly negative. Certainly negative. So it's not here, it's up here. So our QRS axis is at the negative side of lead 3. Can you see the little negative symbol there? It's at the negative side of lead 3, so it's at about negative 60 degrees. Negative 60 degrees. That's interesting. That's outside of normal. We said normal was over here at 0 to 90. So what does that mean? Well, that falls in this range right here. Negative 60 is left axis deviation. And what causes that? This list of things right here. Pathological left axis deviation. Now there's two different types of left axis deviation that this picture here doesn't really show us. There's physiological and there's pathological. And the one way to tell, you know you have left axis deviation. The one way to tell real quickly is if you're past the negative 30 mark. So if you're between 0 and negative 30, you're at physiological left axis deviation, which just means it could be a normal thing for that patient. It could be a normal variant. If you're between negative 30 and negative 90, you're at the pathological left axis deviation, and that means that some sort of disease process is probably taking place causing the QRS axis to be deviated to the left. So looking here at this list, the most common cause is probably a left anterior fascicular block, and you'd have to rule out everything else to sort of discover what it is. This is probably a left anterior fascicular block causing this left axis deviation. Okay, so that was pretty easy, but it does get easier because I don't expect you to carry this hexaxial diagram with you out on the road. There is another way to do it, and in the next part of this discussion, you're going to see how much easier it can be. I promise you, it's easier than that 5 steps, and that 5 steps is actually pretty simple. So I hope you're enjoying the discussion so far. I'll see you back for part number 4, where we make this a little bit easier for you to do out in the road.